A federal advisory committee to the Centers for Disease Control and Prevention is recommending the first coronavirus vaccines should go to healthcare workers and residents of long-term care facilities. The Advisory Committee on Immunization Practices and other health experts voted 13-1 in favor of the guidelines during an emergency meeting Tuesday. We should note the Food and Drug Administration has yet to authorize a vaccine for public distribution. Both Pfizer and Moderna have already applied for emergency authorization. Federal documents obtained by CBS News say the first vaccines could roll out as soon as mid-December. The country has reported more than 100,000 COVID-19 cases every day for nearly a month. For more, let's bring in Dr. Jennifer Cates. Dr. Cates is the Senior Vice President and Director of Global Health and HIV Policy at the Henry J. Kaiser Family Foundation. Dr. Cates, thank you very much for being with us. What are your thoughts on the guidelines the committee voted to recommend this afternoon?
Well, the committee has been meeting for the past 6 months and has considered all of the data, and I think for those of us who've been watching it, we expected that this would be the likely outcome of their vote. And I think it makes sense based on the data we have and that there's limited supply in the beginning. So there's a lot of really important scientific reasons to target these populations.
So last week, one of the members of the committee raised concerns about putting nursing home residents in the priority group. Dr. Robert Atmar said that this, quote, is not a population that's been studied in the vaccine trials, end quote. Now, nursing homes account for over a third of COVID-19 deaths. Why not vaccinate others first?
I think the decision-making that went into this, and then that concern was raised, is that this is a population that has been so hard hit in terms of COVID disease and death. And also because staff of long-term care facilities are going to be in the target priority group, it makes sense to consider vaccinating both the residents and the staff. It's true that the long-term care residents were not actually in the studies, the trials themselves, but the data are strong in terms of the efficacy and safety, and there is going to be follow-up. So I think on balance, the experts on the panel felt that it was important to reach this population quickly.
So I want to ask you about the timeline. According to the COVID tracking project, the current spike in cases is directly related to Thanksgiving-related gatherings. Now, CBS News obtained an internal Operation Warp Speed document showing a December 15th federal rollout of Pfizer's vaccine, and then Moderna's rolling out a week later. So, Dr. Cates, when might we see numbers start to go down?
Right. So if the FDA is meeting on the 10th for Pfizer, a consideration on the 17th for Moderna, and assuming that they authorize each of those, they say that they'll turn around vaccine doses within 24 to 48 hours. Right now, the estimate is that there's 40 million doses available this month that will vaccinate approximately 20 million people. That's great. It's not enough to start to see at the turnaround that I think the country will see later on. I think we're talking several months because vaccine doses have to be produced and sent out, and other priority groups are going to be identified. So, if you're somebody in the population right now who's not necessarily in the priority group, I think we're looking at the summer, late spring and summer, till we start to see a big impact from the vaccine. We'll see it earlier, but what big impact will probably be then, hopefully.
Okay, that's good. Yeah, that's good to know, because a lot of people have been wondering about how long before things can return to some semblance of normality. Well, there are several vaccines in development. Operation Warp Speed's chief science advisor says they are hoping to develop 6 to 8 vaccines, anticipating most of the world will be immunized by mid-2022. Dr. Cates, do you think that that is a realistic timeline?
It's an ambitious timeline. One of the issues that it will come up is that there's going to be countries and populations around the world that don't have ready access to the vaccine, and it will be an important thing for the United States and others to consider how to ensure that everybody can get access. We really can't achieve the global level of herd immunity needed to return to normal across the world. It's not enough to solve the problem in one country or 5 countries or 10 countries. It really has to be a global solution. So that will be something that we should watch for. I assume the incoming Biden administration will be looking at that. And just to bring it back home, we still will be in a situation of having to practice some social distancing for quite a while until enough people in the United States get this vaccine.
It's a really important point. Doctor, you have studied distrust in populations of public health authorities. Which groups are at the greatest risk of not getting vaccinated due to a lack of trust?
I think this is a big challenge that all of us working in public health are quite concerned about. There is some distrust out there. We've seen distrust among some healthcare workers. There's distrust among some populations that have historically had a challenging relationship with the medical system, particularly people of color. And so that's going to be a critical part of this. It's not enough that, to have the science and the strong results and then to actually ship vaccines to states. We have to get vaccines to people, and people have to feel confident that these are safe and these are effective, which they are, but that has to be communicated. So I am concerned. I think one of the advantages of having healthcare workers be in the first priority group is healthcare workers will be good ambassadors. Most of them will not be afraid. I think there will be some, but most won't. They'll be excellent ambassadors to people about why the vaccine is important to take.
And you touched on this a moment ago about access to the vaccine, but what can you tell us about potential costs of the vaccine?
Right. So right now, the vaccine will not cost individuals money. It will be free to you, to me, to anyone else who when they get the vaccine. The federal government has purchased enough doses of the vaccine to pretty much cover that, and there's other plans in place. So cost should not be a barrier for people getting vaccinated. And then that's really important because that's sometimes with other vaccines can be a real issue, but that is not intended to be an issue here. So that is a really critical part of this.
It's important for people to know that as we move forward here. Dr. Jennifer Cates, thank you very much, doctor, for your insight. Really appreciate it.
Thank you.